I figure I've got students that got dual certified this past spring. I'm like, my students trumped me. But they're doing a lot of blocks, and then if they have to convert over to gas, then they will.
Okay.
Yeah, so it's interesting to see what the group is doing. They keep
Yeah.
they keep picking shorter anesthetics than what we used to have, which is great because then,
Yeah.
they have less side effects. So it's kind of interesting
Right.
to see how things are changing. So anyway, I talk about all that. You also get annual updates in the course. And then, so after we talk about the anesthesia stuff, we talk about phase 1 care and then phase 2 care. And then in the course, you get 100 test questions. And after you've scored and gotten your first initial score, and you got to get 70 or above to get the contact hours, and it's 24.5 contact hours for the course. So you got to pass that to get the contact hours. You can take the test as many times as you want to rescore and rescore. There's a review, a rationale review after you've done the first 100 questions, and you can go back and review all of them. And all of the references are there for you to refer to and look up. And it's all based on the curriculum that the test is based on. Core curriculum book, Drains, Perianesthesia Nursing, our national standards of practice recommendations, and then Heeds Wong's textbook, and then Stacy and Erden. That book has been out forever. When I started in 2000 in the ICU, those were the original authors.
Oh my.
Yeah, I think my first edition was the 3rd, and they're on the 8th edition now.
Yeah. Oh my goodness.
Yeah.
Wow.
Yeah. So you get the rationale review, and then at the very end, you do the evaluation. And then once you finish the evaluation, you'll get your certificate in your student portal, and you can access your certificate there for submitting it to your nursing board or to your administrator for contact hours, and also for a license renewal, certification renewal as well. So.
Real quick, while we're talking about this, Kathy, I was wondering, so I haven't gone too far into the forums, but I have kind of gone through the modules, and I just finished the neuro module.
Yeah.
So how were previous people who purchased the certification review course, were they just kind of using this, or were they just, was there other supplemental information that they were using alongside your review course before they took the certification exam?
That is a really, really good question. I get that all the time.
Yeah.
My students come from all over. Some of them have
Yeah.
done other review courses and they have failed. Feel like a lot of the other products that are out there are not comprehensive enough.
Okay.
They're not hitting everything. I've taken that test twice now in the last since 19, and then I took it in 2022. I'm going to take it again to get my CAPA, since I figure I've got students that got dual certified this past spring. I'm like, my students trumped me. So I'll be sitting for CAPA probably in the fall because they do audit. I have friends who have been audited. I have students who have been audited, waiting for my auditing. So I recommend that I think my course is comprehensive enough for you to pass, because the track record.
Yeah.
When I launched it, my goal was 80%, and everyone's doing so good. They're doing so much better than 80%. But if you get stuck, I do recommend that every department, even my department that we just opened up, doesn't have these resources, and I'm already asking leadership to purchase them. So it's the core curriculum by ASPAN, their standards of practice, and then Drains, Perianesthesia Nursing. Now, the difference between Drains and the core curriculum is, if you are an outline person, like if you think in an outline and you don't like all the busy words, then you're going to like core curriculum. Okay. If you like things written out in a paragraph format with more description, more explanation, sometimes even more depth and detail, then drains is what you're going to want. And I've had nurses that are like, nope, I like core curriculum. I have nurses that are like, nope, I love drains. So I recommend every department have both those resources plus the standards, because you're going to need that for staffing, because you're going to have a manager who's going to be like, I want you to be the charge nurse of pre-op, PACU, phase 2, and endoscopy. And be the PACU second nurse. And that's not okay. That's not okay.
Yeah.
Because you're not going to be there when something happens. There's a likelihood not. So you need to have those standards there, because those standards were born out of sentinel events of deaths. And that's why we have those staffing guidelines. The Laidlaw case is referenced into that phase 1 staffing recommendation. So I think every department should have those standards. I keep them in my bag. My nurses were like, oh, I love you. You walk around with the standards. I'm like, yeah, I do.
That's awesome.
So I recommend for your department to buy the references that the test is based on. And then as something crops up in the course and you're like, what's that? What was she talking about? Let's go a little dig a little deeper.
Yeah.
Then you can pull out those references to do that. I do recommend, though, if you have test anxiety or clinical test anxiety, I've got nurses who reached out to me that have clinical test anxiety. And I recommend they reach out to ABPANC, who is the board that oversees the certification, and reach out to them, because with the American Disabilities Act, there are resources for nurses who have clinical test anxiety. Like, you can request extended time. I also recommend not to test at home, because you're going to be proctored on a video camera. My husband just did his degree, and he was proctored on all of his tests. But if he had to pee, the test was it was done. Like, he
shut
couldn't.
off. Yeah.
Yeah, it's shut off. He couldn't leave. So I really recommend getting to a testing site. That way, if you need to go to the bathroom, or if all of a sudden you have that anxiety that kicks in, and all of a sudden now you're like nauseous, or you got to run to the bathroom, you can go and deal with the anxiety that you didn't expect it to be so bad. There are some beta blocker drugs, and if people are interested in that, you can email me. I don't recommend people going on beta blockers, but there are some patients where it is beneficial. So, and then I do recommend that if you have that test anxiety, or you're just not good at test taking, ABPANC sells test questions, and it gets you used to, what the kind of questions they're going to ask. I do know that they'll never ask an accept question. So, like, they won't try to confuse you. I want you to know the right answer. Not the wrong answer, So I tried really hard not to ask any exception questions in my review course, so that it mirrors the, like the true test would be without exception questions. So, and always go with your first instinct. Don't change your answer. This is what I tell my nurses when I coach them, the ones who've failed. Like, have confidence in yourself and go with your gut reaction, Oh, and that's the other thing. Buy the test assured. You never know when life is going to happen. So I think it's like $50. And if you have to reschedule for next testing window, I really hope, well, one, I really want ABPANC to go year round on this test. We are like the only certification test that's not year round. The CCRN is year round. The ER nursing certification is year round. The TNCC is year round. The NRCP is year round. They're really behind on the standard, and I want nurses to be able to test when they're ready. So hopefully ABPANC can make some growth in that area in the next year or two. So buy test assured, because I had to use it the first time. My husband, he ended up having appendicitis emergently, and so an appendectomy.
Oh, no.
Yeah, and then we had a forest fire.
Oh my.
And then we ended up moving, because my husband went back with airlift, and we left the flight program in Bend and returned to the Pacific Northwest. And so then we were moving, and I was like, I don't have time to pack and study and sell a house and recover a husband. So, life happens.
Life does happen.